My name is Dr. Keith Eppich with Village Health Partners, and I'm going to do a sort of FAQ today. And so I will read some questions which are sort of summarized by a large batch of questions we received. First question, how frequently will we need to get this vaccine? That's unknown. The vaccines initially out by Pfizer and Moderna look to be 95% effective. Next question, will this be an annual thing like the flu shot? My prediction is it will not be an annual thing. The flu virus mutates rapidly, and the SARS-CoV-2 virus does not mutate rapidly. I do suspect at some point we'll get boosters of some vaccine in time, but I don't think it'll be an annual thing. That's my guess. That's kind of why it's important to really make sure we document who gets what vaccine. So as we learn more in real time, over time, we'll know, we'll have further recommendations from the ongoing clinical trials on these vaccines as to whether or not we should get boosters in a year or two, and if so, which one. Next question, will I need to wear a mask after I get the vaccine? Probably for a short period of time. It may take till about a year from now until we have a sense of normalcy, but it may be shorter than that. It may be more like summer 2021, where most people who want the vaccine will have received it. And if we get, maybe 70, 75, 80% of the population getting the vaccine, there'll be sufficient herd immunity such that we can discontinue mask wearing. We'll just have to see. Next question. Will I still need a vaccine even though I've already recovered from COVID-19? So the general consensus, by my understanding, is yes, you're still going to be advised to get the vaccine because the antibodies seem to last on the order of 3 to 6 months following a infection by COVID-19. So again, if you've been infected, the early evidence suggests you're going to have about 6 months of protection. It is generally recommended to wait a good 3 months after your infection before getting the vaccine for COVID-19. So if you get sick, wait 3 months before you get the vaccine, but yes, get the vaccine. All right, is the vaccine safe for pregnancy? So the Pfizer and Moderna vaccines are safe for pregnancy. The live attenuated viral vaccines, you should not get if pregnant. The ones that are out now, Moderna and Pfizer, they are safe for pregnancy. And in fact, those who are pregnant are in the higher prioritization list per the CDC. Next question, how can I sign up for the vaccine, and is there a wait list? We don't have a way to sign up for the vaccine just yet. There is not a wait list yet. We are developing our plan, our strategy. We still haven't heard from the state as to when we're going to get the vaccine. As a reminder, the vaccines just started shipping this past week. The state is prioritizing tier 1, and they're going to exhaust all in tier 1 who need the vaccine before sending it further to our clinics. Tier 1 is the hospitals. So the hospitals are getting the vaccine for their employees and hospital workers, and also EMS workers, so fire departments, police stations, they're getting the vaccines as well. Tier 1B is what they call it, would be clinics such as ours. So we don't know when we're going to get it, but we are signed up with the state to receive it. And when we do, then we will administer the vaccine, and we're developing the logistics now of how we're going to immunize our patient population. It is important to note that we just want you to get the vaccine. It doesn't matter where you get it. We just want to be part of the solution. CVS, I understand it, and Kroger are both partners in terms of the supply chain, the delivery. So if you find out you can get it somewhere, get the vaccine. Just make sure you know which one you got. Prioritization is a big question. We had a bunch of questions on when can I get it. I have this condition. I'm this old. Am I going to be high on the list? That sort of stuff. So the CDC has issued a statement, and the concept is they want to keep the healthcare system afloat and also tend to the most vulnerable populations. So as such, they've recommended hospital workers, first line workers in the healthcare industry, and first responders get it first. And then more broadly, the healthcare community, again, to keep the healthcare community functioning. Beyond that is vulnerable populations, nursing homes, and then the two other groups they recommended are those over 65 and adults with certain health conditions, and that's on the CDC webpage. So chronic health conditions such as heart disease, lung diseases, kidney disease, obesity, hypertension, pregnancy, cancer. If you have a chronic health condition and you're an adult, you're going to be in that next batch of groups. So again, hospital workers, healthcare workers, long-term care facility, and then the next batches are going to be people over 65 or adults with chronic health conditions. These specifics are really not nailed down yet by the CDC. And then it's important to note that the CDC just makes a recommendation, and this is going to go to the state. Each state has to make its own prioritization list. Most of them will probably go by what the CDC has put forth, however. And then who should not get the vaccine? Well, all I have right now is information on the Pfizer vaccine. The only contraindication to the Pfizer vaccine is known severe allergic reaction to the Pfizer vaccine for COVID-19 or to any known ingredient in that vaccine. So questions about what if I'm allergic to aspirin or if I have food allergies? Yes, you can get the vaccine. Prior immune issues such as rheumatoid arthritis, yes, you can get the vaccine. Asthma, yes, get the vaccine. Prior Guillain-Barré syndrome, that's a really tricky one. It's not an absolute contraindication. That is probably some question you need to talk to your physician about. Generally, the principle is this disease is so severe, COVID-19, that the benefits probably outweigh the risks for most patients. But I'll defer to your own physician for that one. How much will the vaccine cost, and will the insurance cover this? So my understanding is that the government has issued a statement that that no patient should have to pay for the COVID vaccine. More information as it comes, but I believe this is something that's going to be covered for the entire population. There'll be more sessions like this. I hope you all have a wonderful week and a Merry Christmas and a Happy New Year. Best wishes, and here's to a better 2021.